Throughout today's webinar, we will hear from Don Waldrop from Georgia and Angela Lockwood from North Dakota. I'd like to pass it along to Angie LaFlamme to introduce our presenters today. Thank you for joining us, Angie, and I'll now turn it over to you.
Thanks so much, Kiona, and welcome everyone. As Kiona said, my name is Angie LaFlamme. I am a program specialist with the SHIP team here at the center. And I appreciate you all taking time to join us today for the webinar on quality improvement. This webinar is going to focus on successful quality improvement activities being implemented by Georgia State Office of Rural Health and also North Dakota's Critical Access Hospital Quality Network. So with that, I would like to introduce our speakers. With us today, we have Dawn Waldrop. She is the Director of Hospital Services for the Georgia State Office of Rural Health. She came to the State Office of Rural Health in 2016 as a program specialist, then was promoted to her current position in June 2019. She serves as both small rural hospital improvement program and Medicare Rural Hospital Flexibility Grant Flex Coordinator. She also writes and manages several state and legislative manuals, grants annually for Georgia's 58 small rural and critical access hospitals and rural health clinics. She has a diverse background of experience, including operations manager for 8 clinics for a federally qualified healthcare center, a family law paralegal, 12 years of payroll clerk and benefits coordinator for a school system, as well as newspaper reporter. I'd also like to welcome to our webinar today our second speaker, Angie Lockwood. She is a project coordinator for the Center for Rural Health at the University of North Dakota School of Medicine and Health Sciences. In her roles with the FLEX and SHIP programs, Angie partners with rural hospitals across the state, primarily focused in providing assistance to them in their efforts towards financial and operational improvement. Angie received her Bachelor's of Science degree from the University of North Dakota. Prior to joining the Center for Rural Health, Angie worked in education for a Head Start grantee where she provided training, technical assistance, and curriculum development. So, Kiona, could we have the PowerPoint? I think you're all familiar with us, but I quickly want to just review our purpose. The National Rural Health Resource Center is a nonprofit organization dedicated to sustaining and improving healthcare in rural communities. As the nation's leading technical assistance and knowledge center in rural health, the center focuses in the 5 core areas of transition of value and population health, collaboration and partnership, performance improvement, HIT, and also workforce. So the objectives for today's webinar are to increase knowledge about successful state SHIP quality improvement activity or investment activities, learn about networking consortium development, and then also gain insights regarding overall quality improvement activity, goals, challenges, and outcomes. So with that, I'm going to turn it over to Dawn. And actually, excuse me, I'm going to ask you all to participate in a poll question before we get started. So concerning your knowledge on SHIP program quality improvement, do you feel confident, somewhat confident, neutral, and so forth? If everyone could take just a second to complete that poll question, we'd appreciate that. Looks like we've got a little bit of almost every area here. So we hope those of you that feel confident and somewhat confident we'll still get something from the presentation. I'm sure you will. Don and Angie have prepared some really nice information. So with that, I am going to turn it over to Don to get us started. So welcome, Don.
Thanks so much, Angie, and thank you, Kiana, too, as well. Hello, everyone, and good afternoon. I first want to thank the Center for the opportunity to present my program to you today. I certainly hope that you all will find something beneficial in what I share. So I'll go ahead and get started. But first, I'd like to share our mission, which is to provide access to affordable quality health care to Georgians through effective planning, purchasing, and oversight. Our objectives today are to provide background on the development of the HCAHPS to Guide Change Consortium, to explain why we chose this consortium for our hospitals, and to outline the overall goals and outcomes we hope to achieve with this project. In Georgia, we have 58 hospitals eligible to participate in the SHIP program. The State Office of Rural Health within the Department of Community Health provides oversight and management of the SHIP program. The store office is located in Cordell, Georgia, which is in Crisp County, as you can see here circled in red on our map. For a little background, in FY18, we offered a choice of 6 consortiums with a variety of program choices, or the hospitals could choose to be a direct grantee. All 6 consortium options were great programs. We offered telehealth business and legal strategies, using the Medicare cost report to estimate service line profitability, financial stability, and population health, a care transitions collaborative, provider documentation training and compliance audits, and a strategic pricing initiative. So with that, 42 of our hospitals chose projects among the 6 consortia. Some had as few as 2 hospitals, and some had as many as 14, and 14 hospitals chose to be a direct grantee. This came to a total of 20 sub-grantees and projects. So what we learned was that although the choices were all great projects, sometimes more is just too much. Hospitals had a difficult time choosing which initiative best suited their needs. We were hearing that they wanted the training and education offered by the consortia, but needed the HCAHPS subsidies to offset their vendor fees. The programs with the fewest participants, some as few as 2, lost interest, both consortia and the hospitals, and the hospitals were a bit confused. They couldn't remember which program they had chosen. We had difficulty collecting invoices and final reports from the direct grantee hospitals, and some of the newer consortia had poor participation and were reluctant to submit their final reports. And needless to say, managing 20 separate grants was very burdensome. So that's kind of me in that whirlwind of paper there. Historically, we have had difficulty getting our grants executed in a timely manner. So having 20 separate grants slowed the grant execution process down even more. So we had to find a solution. We asked our hospitals what they wanted. How could we help you? We conducted an environmental scan via SurveyMonkey with 3 goals: to document the challenges encountered, to elicit the opinions about the availability, quality, and value of the SHIP programs and services, and to elicit innovative ideas for improvement. We also utilized comments and evaluations from previous grant year final reports, and we sought input from 2 stakeholders that are the most in touch with our rural providers. That would be Georgia Hospital Association and Hometown Health. GHA and Hometown also work with us on our FLEX program, so they are very familiar with our rural landscape. We were happy to learn that, according to our survey responses, 100% of our hospitals valued their SHIP investment. As we anticipated, our hospitals really needed the HCAHPS subsidy to offset their vendor fees, and they also wanted the educational and training opportunities provided through the consortia programming. The third need was a desire for quality improvement initiatives in our rural health clinics. We did not pursue an RHC initiative within the SHIP this time because we had other projects ongoing We had a legislatively mandated patient-centered medical home recognition support grant, and we had a state-funded contract with the POND program, a Practice Organizational National Database. So based on our survey, we collaborated with GHA and Hometown Health, who both have a long history of providing exceptional programming for SOAR. We developed programs to address the two top cited needs. The HCAPS to Guide Change Consortium was developed in partnership with the Georgia Hospital Association, and we chose to address care coordination with a Special Innovation Project option in partnership with Hometown Health. Since the SIP would follow a 4-year work plan, we decided to align the HCAPS to Guide Change project along the same format. Our option C was to opt out of the program, but all hospitals chose to participate. And both programs follow a 4-year plan. So 39 of our SHIP eligible hospitals chose the HCAPS to Guide Change Consortium. They are located in the counties here colored in red. The remaining hospitals in the counties colored blue are the hospitals participating in the SIP, or Special Innovation Project. The HCAPS to Guide Change Consortium is 100% value-based purchasing initiatives with the goal to improve data collection and reporting to increase clinical quality and financial efficiency, and for 100% of hospitals to publicly report their data. Our HCAPS program incorporates the Institute for Healthcare Improvement's collaborative model for achieving breakthrough improvement. Hospitals are provided tools and structure to utilize their baseline HCAPS data and work toward outcomes for quality improvement. Their HCAPS scores are used as the tool for change, hence the HCAPS to Guide Change name. The program provides professional development to senior level administration, including C-suite and board members, incorporating a top-down approach to changing the hospital's culture. Each hospital in this consortium receives $6,000 to offset their vendor fees. So the SOAR, we pay $11,866 for each of the 39 hospitals to GHA, and then GHA funds the $6,000 back to each participating hospital. It saves a lot of paperwork and time. So we are focusing on improving the patient experience by integrating patient and family engagement and patient and family advisory councils in each hospital. The PFE initiative engages hospital administrators, frontline staff, and all who work in the continuum of care in the prevention of hospital-acquired infections. The subject matter expert is a patient advocate who established the Safe Care campaign after 3 members of his family became infected in 3 different hospitals in 3 different states within a 10-month time frame. His son ultimately died at the age of 27 from a hospital-acquired infection. So he uses his tragedy to inspire and effectively train hospitals to achieve stated goals of CMS's Partnership for Patients. We're also implementing patient and family advisory councils as we move into the new era of transparency. PFACs implement evidence-based best practices, engaging patients and families to improve communication that leads to a partnership in the delivery of care. This partnership supports high-quality outcomes and potential performance improvement for the hospitals. The subject matter expert for this project is a healthcare attorney who guides hospitals in the development of PFACs, the key elements of a successful council, the scope of engagement, the opportunities, and the legal challenges of incorporating a PFAC. We are also providing on-site team steps training at each of the 39 hospitals. Team steps will improve staff communication and teamwork skills to optimize patient outcomes and improve patient safety. And while on-site, infection prevention staff receive individual technical assistance with enrollment and navigating the National Health Safety Network for tracking and reporting healthcare-associated infections. This will also assist in increasing the survey return rate, which continues to be an issue for many small rural hospitals. Since we designed this program to span a 4-year period, these initiatives continue to build on prior year successes and lessons learned and continue to adapt and adopt tools and strategies to optimize achievement of these goals. So all of these initiatives I just told you about support our overall goal, which is to improve the quality of care provided by our small rural hospitals. And as most of you are aware, our small rural hospital staff are very busy people who wear many hats. We have learned that our best strategy is to keep things simple. We're doing our best to meet these staff where they are. We are hosting meetings regionally for convenience of travel, and we are incorporating as much professional development and educational opportunities as we can at spring and fall conferences, as well as offering monthly webinars and unlimited technical assistance. So with that, I will leave you with our purpose, shaping the future of a healthy Georgia by improving access and ensuring quality to strengthen the communities we serve. And this is my contact information. And again, I thank you for the opportunity to share my program today. So this is my contact information if you would like any more information or would like the slides. And thank you very much.
Thank you so much, Dawn. Just a note to everyone that in the lower left-hand side of your screen, there is a file share pod where you are able to download the slide deck from today. So please feel free to do that. Does anyone have any questions for Dawn right now? You can unmute your line by pressing *2, or you could type something into the chat box. Okay, so hearing nothing right now, we will move to Angie's presentation. Let's see if I can, there we go. Angie, welcome.
Thank you. Well, good afternoon, everyone. My name is Angie Lockwood, and I am with the UND Center for Rural Health and the FLEX program, and I am presenting today on behalf of Jody Ward, who is our North Dakota Critical Access Hospital Quality Network Coordinator. So Jody is traveling. She's in flight right now, so she had asked us to stand in for her today. So we will do that. So it's myself, Angie, and then Julie Frankel is a project specialist with the Quality Network in our state, and so she's here as well. And Jody's contact information will be listed at the end of the slides. So we will probably be able to answer some questions. Please don't hesitate to ask them. But if we don't know them, we'll write them down and share them, forwarding to Jody. And as I mentioned, her contact info is there as well. So today we are sharing on the North Dakota Quality Network and HCAP best practices for quality improvement. Do I advance these slides or?
Yeah. Do you see the arrows in the lower left hand?
Oh, okay.
There you go.
So, all right, and then just, oops, we did it twice. Little background about our center and our program. We are within the Center for Rural Health. Established in 1980, we're housed in the University of North Dakota, the School of Medicine and Health Sciences, located in Grand Forks, North Dakota. Jody is at a remote location in Minot, North Dakota, so we're a little bit spread out. We are one of the country's most experienced state rural health offices, one of the first rural health offices, home to 7 national programs, and we focus on a variety of things, educating and informing, policy, research, and evaluation, working with communities, American Indian, health workforce, hospitals, and facilities. There's our website address at the bottom. So under the umbrella of our FLEX team, we've got several folks. Jody's listed there, Senior Project Coordinator, the North Dakota Quality Network Coordinator. myself and Julie are reflected on there as well. So Jody asked us to focus a little bit on the development of the network and kind of the origins and how it all got started. So the network was established in 2007. An executive committee of critical access hospitals representatives serves as kind of a decision-making and advisory body, and they provide leadership to the members and oversight of the coordinator. That's Jody's effort. So they can convene frequently, and she uses them for information, to solicit ideas, thoughts, feedback, and to help guide the efforts of the network. The network is a common place for North Dakota critical access hospitals to share best practices, tools, and resources related to providing quality of care. There are a variety of education and different activities, regional and state level networking and peer-to-peer sharing. One of the goals is to reduce and prevent duplication of efforts statewide, and to that effect we have a stakeholder committee represented by a variety of statewide partner organizations, and they also, that helps keep communication open, providing a link and the feedback to keep that communication open and so that we dovetail and, like I said, do not duplicate efforts. We'll talk in a little bit, we also have a virtual library to house online sharing of resources. That is just specifically for our North Dakota critical access facilities. It's password protected, and there's a lot of information that they share with one another on there. And some of the efforts of the network have expanded beyond quality improvement. So we have expanded QI, and we partner with, on our stakeholder committee, we have a lot of, like I said, statewide partners. So we have our hospital association represented, our QIO, we have our Department of Health, hospitals and facilities, trauma, EMS, who else, Jody or Julie? We have Blue Cross Blue Shield, we have stroke, we have health information network, so we've got a variety of partners. On this slide here, it features our networking pattern, and so you can see the blue H's are all critical access hospitals in our state, and then the colored X's are the tertiary facilities, and it's the networking pattern for those. Under where it says executive committee, so what's represented here are the position makeup of our executive committee. So currently at this time we have one of our executive committee members is the director of patient care. We have 3 directors of nursing. We have 2 CEOs and 1 quality risk manager. And those are kind of the types of positions that we like in our executive committee board members, just because of their positions and their perspectives. So those are usually the type of positions that we feature in that group. The network's mission is to support ongoing performance improvement of North Dakota critical access hospitals. And the executive committee meets approximately once a month to help provide guidance to the network and the activities that are for all of the North Dakota cause. There's collaboration between the cause and tertiaries are shown on this map. Let me go ahead to the next slide here. Oh, I didn't need to go there yet. These are a little bit different order than I had, so give me a second to catch up here. So with the development of the network, what was happening is that we convened these groups and these folks in our state and prioritized the CON needs for technical assistance. And again, that was initially around quality improvement. So the activities that have come to be featured in the network are various items pictured on this kind of map here. So established in 2007, we've got 36 critical access hospitals that are all members, intended to be a voice for North Dakota cause. It focuses relationship building between cause and tertiaries. The network supports the CMS conditions of participation, and that really, the COPs has been one of the greatest successes among the cause, and we attribute that to the transparency of our facilities willing to share their survey experiences, including deficiencies that they get. So over time, what we have seen in our state is the transparency and the sharing of what was found, what did they do to correct it, what all the details around that kind of thing have over time now we have found helped the cause in our state receive less deficiencies. And we feel the network meets quarterly for networking conditions of participation, peer-to-peer sharing. So those are those calls that talk about their experiences. Everyone's on there. They get to talk about, they get to walk through what their experience was, questions, details, things like that. So it's really great. Especially our hospitals tell us it's especially useful for the ones who haven't been surveyed but know at some point there's ones coming up, so they just keep really kind of a keen ear to what some of the focus areas seem to be at the time and things like that. So moving on with this map after COP here, the network supports COD needs. They also participate with EDCAPS, HCAPS Collaborative, participate with the QHA, which is our state's QIO, healthcare associated infection prevention efforts, stroke, cardiac task force. Jody also sends out periodically a listserv. So cause in the state can ask questions and say, hey, does anyone have a policy for this or that? Or is anyone experiencing, what do you do about this or that? So, and they can all answer one another on, through that listserv. So that's been really useful. The virtual library of shared tools, I mentioned that is on our website, and it's password protected, and it's information that's just specifically available to the North Dakota cause. So there are different documents and whatnot on there that are just really meant to be really useful resources and tools to assist them with their quality improvement efforts. Okay, in terms of HCAPS, so back several years ago, the network assisted cause in identifying a vendor, and at that time, initially we had 29 of our 36 critical access hospitals under a group rate with one vendor, and the other facilities had individual agreements with other vendors. They just preferred to do it that way. So that's the way it was set up. So the good news, 100% or 36 out of 36% of the cause were and continue participating in HCAPS. In terms of HCAPS information and support provided through the network sends the FMT reports. They were sent to cause, and the data results were discussed by email as well as by phone calls, so with just kind of individual attention to each hospital's reports and information in the data contained. Other things discussed were how to improve, what tools or examples they might want to use or consider using to improve in areas that they have opportunity for growth. The network hosts quality COW regional meetings. We kind of divide our state up into 4 different regions, and so we have quarterly meetings for each of those, what we consider to be the regions in our state. So during those meetings, CAUs from each region are identified as high performers, and they're asked in advance to share for peer-to-peer learning. So what were they doing? You know, they're getting great scores. What are they doing to reach success in their HCAP scores? And examples of things that they have tried, successes, challenges. You know, we tried this, but it didn't work, so then we tried this instead. So identifying high performers for peer-to-peer learning, sharing success stories, and improving their HCAPS rating. The Flex Program and Quality Network have, over the years, also offered online access to a program called the HCAP Breakthrough Leadership Series. I'm going to see if I need the next slide or not. Yep, I do. Thank you. So this is education that's online and available free to the North Dakota Critical Access Hospitals, sponsored through the Flex Program and Quality Network. So it provides engaging and educational how-to roadmap information. So the goal is to successfully drive positive frontline behavioral changes at every level. So the webinars are scheduled on Tuesdays at noon, and they go through September 2020. And they focus on various areas of HCAPS, and they provide suggestions and ideas and resources and tools on how to improve those scores. So examples of some of the struggles that our hospitals have had. So the network has provided hospital reporting assistance. So one example of this is data not showing up on Hospital Compare or FMT reports. So an example of one time when this happened was several of our hospitals in our state are system affiliated, as in lots of states, and this example that I'm sharing was this system did not know to let their vendor know it's okay to share the data with Hospital Compare. So it's just a goofy little oversight thing. But what ended up happening is it just wasn't showing up. So we worked with the hospitals and the system, and the problem was identified. And then individually, they each needed to be sure to check a certain box to allow the data to show up on Hospital Compare. But again, it was, you know, kind of challenges, troubleshooting, and, you know, implementing steps to kind of reconcile those challenges. Another struggle is sometimes understanding reports from those FMT reports. You know, what are the definitions? What's NA? What's the STAR rating? So education was provided on just some of those, just to help understanding the language and what the reports are saying. Over time, so it's been several years now, and certainly needs can change, and services and features within different vendors change over time too. So the network has helped facilitate finding new vendors when needed. When the needs changed, maybe they needed more detailed reports, or maybe they needed calling versus mailing. They were wanting to increase their return rates or whatever. So the network has continued to support and help with improvements to those challenges. Okay, so again, this is the Flex program contact information. Jody is there, she's W, so she's last, but she is the coordinator of this network, and so we've got her information there. And if anyone's got questions about the stuff that we walked through today, I would be happy to take notes for them and have Jody follow up with you, or you can certainly just write down her information and contact her directly yourself as well if you'd like. So does anyone have questions about what we walked through? Okay, I'm not hearing any.
we've got a couple of questions in the chat box. Michelle Hoffman from South Dakota is asking, who provides your HCAPs Tuesday morning, the education portion?
Hi, Michelle. Are you asking about those HCAPS breakthrough webinar series webinars? Is she saying yes?
She says yes.
Okay. Sorry, we're having connection issues here. Yes, so you're asking about the webinar series. That's custom learning. Okay, yeah, you're welcome, Michelle. Thank you.
Any other questions for either Dawn or Angie? You can unmute your lines by pressing *2, or go ahead and utilize the chat box as Michelle did. All right, with that, I am going to turn things back over to Kiona.
Great, thank you, Angie. I want to take a moment, and while I'm going through these resources that I have on the page here, if Soleil or Janine want to share any updates from HRSA or any feedback or input from today's presentations, please feel free to *2 to unmute. But quickly, in the slide deck here, and you can click the links and it'll bring you there. Otherwise, you can gain access to these within the slide deck located in the file share box. But we have identified the quality improvement collection on our resource library, along with the collaboration building collection and the Rural Health Networks and Coalition Toolkit.
Thank you so much for this presentation, everybody. This is Soleil, and I do want to take the time to actually thank our two speakers today. This was wonderful, and I also got a lot from it. Not a lot of input from us from the federal office right now. Thank you all for submitting your NCCs. We are hard at work on them, and we'll be getting back to you guys with the final numbers for the SHIP hospital amount per hospital. So hold tight, and we'll have those to you. Have a good one.
Thank you, Soleil. So now we're at the end of our presentation, but we asked this question at the beginning, and I want to ask it now. So concerning your knowledge on the SHIP program quality improvement, I feel, and will you please identify how you feel after this presentation? So confident, somewhat confident, neutral, somewhat unconfident, or very unconfident? And I'll give you just a few moments before we transition into our closing, where I have just a few more announcements for you. Great, thank you. So as we close today, we have a few more poll questions that I'd like to share. And while I put these up and throw them into this box here for you to answer, I just have a few upcoming TA announcements. So the NCC grants you guys just submitted, we're gathering some information from that, but we also have our TA assessment that is being created. So you can look for that to be sent out, and we're taking the feedback that